Well, this morning we're continuing our conversation on breast health during Breast Cancer Awareness Month. Joining us this morning from Breast Radiology, Bay Radiology Women's Imaging Center, we have Dr. Lindsey Weinstien Davis. Good morning, Dr.
Good
Lindsey.
morning.
How are you doing?
I am great. How are you?
I'm good. How are you? Well, it's Breast Cancer Awareness Month.
Absolutely.
October is getting ready to wrap up, but you're staying aware all year round and warning women of the signs and doing imaging over at the Radiology Center. And something that people hear about is dense breast tissue.
Yeah.
Can you explain to us what that is?
Yes, absolutely. I'm glad we're talking about this. It's a very important topic that is becoming more, we're becoming more aware and notifying patients. It's so important that actually there's new legislation that there's a new FDA mandate that just went into effect in September, requiring radiology facilities to notify patients if their breasts are dense or not dense. But we need some education so patients know what to do with that information. So when we talk about breast density, what we mean is it's just how the breast tissue looks on a mammogram. So it's a visual assessment that we do. It's not something that you can tell on self-exam or clinical breast exam. When we look at the mammogram, we make a determination of the amount of the different types of tissue that we see in the breast. So we have glandular tissue, we have fatty tissue, and then we have the fibrous connective tissue that holds it all together. And when we look at the mammogram, if more than half of the mammogram has that glandular and fibrous tissue covering it, we consider that to be dense breast. And why that matters is a couple of reasons. Number one, the dense breast tissue is white, but breast cancers are also white. So that dense breast tissue can hide cancers on a mammogram. We liken it to finding a snowball in a snowstorm. It just limits the accuracy of the mammogram. But the other important feature is that having dense breasts actually increases your risk for breast cancer. On the order of having a family member with breast cancer, so it's equivalent to having a family history. It's a bit of a double-edged sword. We have patients who are at higher risk for breast cancer, and the mammogram is not enough to properly screen them. So in those patients, then they'll get that letter in the mail that says, talk to your doctor about what to do next. And what we need to do next is additional screening with the mammogram plus another test, usually ultrasound.
Yeah, that's what I was going to ask. If you got those results back, kind of what are the next steps from there? What would you do after you got your mammogram if you found out you had dense breast tissue? Right.
So we recommend additional screening. Our mammogram is still important. All patients should still have a mammogram because there are features of breast cancer that are unique to a mammogram where we would miss them on other tests. So we add typically ultrasound, and then in some patients who are at even higher risk because of genetic mutations or whatnot, we may add contrast-enhanced imaging like MRI or contrast-enhanced mammography. But ultrasound is widely available. You know, really any radiology facility has that at their fingertips. And so what we add is a screening breast ultrasound where they look through the breast tissue with ultrasound to look for any cancers that might be hiding on the mammogram. At our facility, we use a machine called ABIS, which is just a specialized machine that's built just for screening breast ultrasound, but traditional ultrasound is also effective.
And would that be like a yearly thing that you would have to do once you find out that you have dense breast tissue?
Right. So we usually, the first year they might be off cycle, but then we try in the subsequent years. When you schedule your mammogram, you just also schedule your screening ultrasound, and we do those at the same time and read them together. So, using both sets of information, it really increases our diagnostic accuracy.
Of course, and I know you mentioned family history. A lot has been talked about too with younger women getting diagnosed with breast cancer. If you have that family history, what is your recommendation for starting those mammograms?
So we recommend that you start having those conversations with your doctor in your 20s because we use risk assessment models that we take into account your family history, but also lots of other, data from your medical history to calculate a risk score. And patients who have a risk score higher than 20%, we add additional screening, and we may even start screening them younger than 40. So everyone starts at 40, but we sometimes will tailor that to begin earlier in your 30s.
All right, and Dr. Lindsey is going to be sticking around with us today because we are having a special edition of News Channel 7 at 11 with News Channel 7's Donna Bell and Jessica Foster. And we're going to be talking about all things breast cancer awareness, resources, and Dr. Lindsey is going to be here speaking again about the importance of mammograms and much more for our community as well. Thank you so much, Dr. Lindsey, for stopping by this morning, and be sure to tune in to News Channel 7 at 11 a.m.